This is an article that came out in The Fix, January 18th, 2018. I will leave the link to this article in the description box. The suicide rate has risen 32% over a 15-year period, and researchers believe the number is probably higher due to increasing misclassification of intoxication suicides. Due to a significant gap between suicide rates and drug intoxication mortality rates, researchers are stating that many deaths reported as opioid overdoses may have actually been suicides, according to the study from the Luxkin School of Public Affairs at the University of California, Los Angeles. Both the suicide rate and the drug intoxication mortality rates in the U.S. rose over a 15-year span. Using the CDC data, the study published in the journal PLOS 1 states that from 2000 to 2015, the suicide rate rose from 10.40 per 100,000 to 13.75 per 100,000, though 32% is a significant increase. Researchers say the number is likely even higher due to the increasing misclassification of intoxication suicides. Additionally, from 2000 to 2015, the U.S. drug intoxication mortality rate for those over the age of 15 has risen 257% from 7.8% deaths per 100,000 to 20.07 deaths per 100,000 in 2015. Study author Mark Kaplan, a professor of social welfare at UCLA, told NBC Los Angeles that this gap implies a lack of suicide reporting. Unfortunately, part of the problem is due to a serious under resourcing of state and local death investigation systems throughout most of the U.S., Kaplan states. Many of these deaths were probably suicides, yet reported as accidental self poisoning rather than intentional self harm, particularly among the middle aged. The study states that when it comes to suicide by overdose, suicide notes and psychiatric history are important in helping professionals identify a death as a suicide when the distinction is not so obvious. A suicide note prior suicide attempt or affective disorder was documented in less than 1/3 of suicides and 1/4 of undetermined deaths, stated the study. Our corporation of undetermined deaths, as well as registered suicides, not only provide a window on the nature of suicide misclassification within the undetermined death category, but within the accident category, as much larger reservoir of obscuring drug intoxication suicides. Researchers state that because of the opioid plague in the United States, accurate reports of suicide numbers are more difficult to determine. In fact, in 2015, the Center for Disease Control and Prevention even hosted a meeting to address the challenges presented for medical examiners and coroners when it comes to fatal opioids and other drug intoxication cases. Drug intoxication deaths are thought to be among the most challenging for which to determine manner of death. Read a summary of the meeting's findings. This is in part because of potentially equivocal evidence and intent to die. The overlapping demographic groups affected, i.e., middle aged men, and overlapping pre-morbid risk factors, substance abuse, mental health problems. Both studies indicate that more research is needed in order to fully understand the accurate number of suicides by overdose, though that number may never be exact. I think they undercount everything. I think they're uncounting the suicides. I think they're undercounting drug deaths. I think everything in this country is being undercounted, and for very obvious reasons. But tell me what you think, ladies and gentlemen. Please leave your comment and subscribe, and also share the video. Um, and also join me over on Black Junction TV and blackspot.com. Peace, family.